A Minnesota EMS task force held its fourth public hearing session in Winona today, focusing its attention on the needs and concerns in the southeastern part of the state. News 19's Tate Wisey has the story.
The task force, comprising of healthcare professionals, policymakers, and community leaders, aims to gain insights directly from Minnesotans to inform policy recommendations and improve emergency healthcare delivery statewide.
EMS is tired. It needs help, and we're trying to get a hold of what's going on in Minnesota and try to make systemic change.
The hearing provided a platform for residents, EMS providers, and stakeholders to voice their concerns and share firsthand experiences regarding the state of emergency medical services in their communities.
We're hearing things about the reimbursement rates and the financial hits that cities are taking, the cost that's incurred by cities and communities for their EMS services that cause a shortfall because reimbursement rates, particularly with Medicare and Medicaid, don't keep pace with the actual costs of the services themselves.
However, financial problems are just the tip of the iceberg.
It's not just money. Obviously, money is always at the root of the needs in order to fulfill some of the other obligations we have in EMS. But it also has to do with the fact that we need people, bodies. And we're seeing a declining enrollment and a declining number of volunteers coming to the table to offer their time and services to EMS.
With a legislative session beginning soon, representatives on the task force are looking to take in as much input as possible. That way, they can come up with the best solutions that will help solve this crisis.
Representative Hewitt and I are going to go back to our respective bodies and talk about what we've learned and work together to craft whatever legislation we think we can get done this session, but continue the discussion so that in the future we're implementing, hopefully, systemic changes, long-term changes that can really affect the health of the industry.
Reporting in Winona, I'm Tate Wisey, WXOW News 19.
And the EMS task force plans to continue its series of field hearings after this legislative session, thus ensuing that the challenges faced by each community are thoroughly examined and addressed.